Thank you for joining me today. In this video, you will learn Lamictal. Lamictal is a medication that treats seizure and bipolar disorder. I have a case study on Lamictal. And Lamictal case study is that a 27 years old female presented to outpatient mental health clinic for evaluation of a mood instability because this medication stabilized mood. She has history of a recurrent depression episode since the late teenager years and reported a period of mood elevation characteristic by the increased energy and decreased need to sleep without making an impulsive or psychosis. She has no significant medical comorbidities. Past psychiatric history include treatment of selective serotonin reuptake inhibitor, which result in a partial response and occasionally mood worsening. She has also family history and is bipolar disorder in the first degree. Family relative. So her family relative has a bipolar and she is coming with symptoms of bipolar. Those all the symptoms that she mentioned are bipolar symptoms. So the present symptoms include recurrent depression episode lasted several weeks. She has a low mood. She has sadness and fatigue and poor concentration. She has intermittent period of increased energy and productivity. She has a decreased need for sleep during elevated mood period. She has mood reactivity and emotional lability. She denies suicidal ideation and psychosis symptoms, and she also denies using any substance or drug use. Mental examination revealed that a cooperative, well-groomed individual with a mild depression mood and cognitive effect. Through process, linear, and insight and judgment are intact. So her thoughts and judgment are intact. Clinical assessment is based on clinical history and symptom pattern, and the patient meets a criteria of a bipolar 2 with a predominantly depression episode. She has a depression episode. She has a brief of hypomanic symptoms, given her sensitivity to anti-depression medication and depressive predominantly of her illness. Mood stabilizer with a strong anti-depressive effect was considered, and Lamictal was chosen. And the reason you will select Lamictal is because Lamictal has a strong evidence for maintaining and treating bipolar disorder. particularly bipolar with depression, and it has a favorable side effects compared to other mood stabilizer. Minimum risk of weight gain. So Lamictal has a minimum risk of weight gain. It has less metabolic effect or sedation. So it has less sedation, it has less weight gain or metabolic effect. It has a low risk of inducing mania compared to other antipsychotic monotherapy medications. Suitable for a long-term mood stabilizer. So Lamictal is used to long-term mood stabilizer because it has a less side effect compared to others. Given the knowing the risk of serious rush include Stevens-Johnson syndrome, a low titration schedule was planned. This medication has a side effect of rush, skin disorder, Stevens-Johnson syndrome. That is one of the side effects of this medication. So you will educate the patient about the medication purpose, reason she will use this medication, and the reason you are prescribing. The medication must be started at the low dose and increased gradually to reduce the risk of skin rash or Stevens-Johnson syndrome. So you want to start low and increase slowly so you can know if the patient is developing skin rash. You want to teach her to report any rash immediately, especially if you have a fever, sore throat, cough. Also, you want to teach the patient the side effects of this medication that include headache, nausea, dizziness, blurry vision. You want to emphasize and teach them missing a multiple dose may require restarting the medication. So you want to teach them to take the medication regularly to be effective. You want to discuss contraindication and notify the provider if you are planning to get pregnant, because this medication is contraindicated for pregnancy. The patient has to verbalize understanding and agree to the treatment plan. The lab, there is no routine lab monitoring for this medication for adults who are healthy otherwise. You want to do pregnancy test before you start this medication. You want to also do a liver and kidney function and review the clinically. You want to review that before you start. Clinical monitoring include the emergency of a rush if you develop rash and hypersensitivity reaction. If the patient, you will teach the patient if they develop sensitivity to the medication, that is emergency, and they should call their provider or go and seek medical attention. Mobilize mood and recurrent of depression and hypomanic. If the symptoms continue, you wanted them to seek medical attention and come back and see their provider. They have to take the medication as prescribed. There is a drug-to-drug interaction, particularly hormone contraceptions. If she's taking contraceptions, there is a interaction between that, so she has to be telling her provider. This medication takes at least 8 weeks, so you want to have a follow-up appointment after that. 8 weeks. Within 8 weeks, after the therapeutic dose, you want to increase the dosage slower and slower, gradually. You want to see the treatment outcome that you want to see will be the improvement of depression symptoms, more stable mood with a fewer fluctuation, improved sleep quality and daytime function, no episode of hypomania. You want her to deny having or not have a rash, fever, or concern or face effect. No headache reported, and follow-up plan will be if she is having all this effective treatment. If the medication is treating her symptoms and treatment is effective, she should continue the medication. And if she is not, you have to discontinue the medication or increase the dosage slowly. So follow-up appointment will be continue at the current maintenance dose, monitor the mood symptoms at 4 weeks intervals during the first year, and reinforce education regarding the rash, vigilance, and medication adhesiveness. So you want to reinforce that if you see any skin changes, any rash, any irritation, any sore throat, any of these symptoms, call us, come back so we can adjust your dose or change the medication. You want to encourage them psychotherapy as a added to the pharmacology therapy. You want to reassess you want to assess a need for additional mood stabilizer or anti-depression medication if the symptoms still continues. So Lamictal is indicated for seizure, as we mentioned. It treats bipolar 1 and bipolar 2. It stabilizes neural membrane by inhibiting sodium voltage gate channel and reduces glutamate release. Some of the common side effects include dizziness, headache, tremors. It includes nausea, which is rare but serious. Potential viral rash, Steve Johnson syndrome, which is viral and require gradual, slow dose titration. Gradual. Okay. It is mood stabilizer. Thank you for joining me, and please subscribe. Please subscribe. Thank you.